Hi, this is Bill England. I'm the State Director for Enroll America here in Pennsylvania. Today we're at the Drexel Medical College for a talk with Philadelphia Jazzbridge about the new Affordable Care Act, Obamacare as it's known. I work for Enroll America. I started July 1 as the State Director here, and I was hired because of my experience in outreach with the Children's Health Insurance Program, which was back in the late 1990s. I spent a little bit of time in DC working for some national health advocacy groups and landed here in Philadelphia about 10 years ago. Enroll America is a nonpartisan, non-political organization. We don't actually do the enrollment despite the name of our organization. Our job, our role, what we find to keep us busy for 70 hours a week is just trying to do education and information and try to find good ways to get to the folks out there who are going to benefit most from the Affordable Care Act. So that's a little bit about Enroll America. This is just to give us a little background. We're at a point in time in our history, we're the only industrialized nation that does not make provisions for health care for every one of its citizens. It's ironic to me, when I was doing the CHIP outreach work in the late 90s, I used to say it was the United States and South Africa were the only two. Well, we're the only one. This is a step in the right direction. We have 46 million uninsured people in our country. That number has actually dropped by about 3 million people over the last year as a provision of the Affordable Care Act. The Affordable Care Act now allows children to stay on their parents' coverage, where there's coverage in the family, till age 26. That was a big improvement. That kept 3 million people insured. We spend an unbelievable amount of money, and it's only going to continue to increase. So part of what this is about is trying to rein in the costs of what healthcare is. Here in the United States, it's $3 trillion annually, and that's having 46 million uninsured people to boot. 17.9% of our economy is consumed, so it's big and it's growing. It'll grow to 20, it'll grow to 25 if we don't find ways to rein it in. And it's predicted by economists by 2040, $1 out of $3 of the economy would go into health care if it was left just the way it's been going. The Affordable Care Act, as I say, adults up to age 26, that's a major improvement. Medicare, it doesn't do a lot for Medicare except two things that are important. So anybody who's got Medicare or getting close to Medicare, it has added preventive screenings, which are critical. Those are now covered as a benefit of the Medicare program. And that little donut hole that was created out there that costs my parents and my in-laws every year, that donut hole shrinks over the next few years to the point where that big hole that people had to put out $2,500 or $2,600 towards medications is going to go away over time. It also prohibits insurers from imposing limits on the amount of money that they're willing to spend on your health. Most insurance plans, a lot of insurance plans, come with some sort of an annual or lifetime limit. I know that the plan that I have through my wife's employment, which is a pretty good plan, it taps out at $1 million. Now you hope you're never going to have to spend that, but it's only one catastrophe away from having unbelievable spending. And what happens when you reach that cap? You're done. You pay for it. That goes away January 1st. The Affordable Care Act reins in insurance rates, and one of the ways it did that, there's a new rule called 80-20. 80-20 says that for the money that insurers collect from people who are buying their products, 80% of that has to be spent on your services, 20% can go towards marketing. As they exceed that, last year that was worth billions of dollars, that money gets rebated to the people who have insurance or their employers. So that's a change. This is a way to try to limit the amount of marketing that's going on there. Denials for coverage for pre-existing conditions. That's massive. Every one of us has or knows somebody who has a pre-existing health condition. And somehow that got into our healthcare system. I have somebody in my circle who happens to be HIV positive. And this pre-existing condition is a nightmare that kind of hangs out there. And what has happened with this person during periods of unemployment, this person has had to spend all the unemployment money and whatever else to pay the COBRA fee to maintain that health coverage so that it wasn't dropped and that they didn't get socked with a pre-existing condition. The hope is that it's going to make it affordable. Now here in Pennsylvania, we are a federal marketplace. All that means to us is that our state is not participating in the marketplace here in Pennsylvania. The Department of Health and Human Services is setting that up. And so we don't know a lot about some of the details that we will know in just a couple of days. Like what the costs are going to be, for sure. There's some estimates out there now. But in states where the states are involved, New York, California, and Maryland, through studies that they've done very quickly, they're projecting insurance premiums to drop by sometimes up to 50%. This is going to make it affordable. Everybody is going to benefit eventually from this thing. So I want to talk a little bit about the financial assistance that's available to people. Nearly everybody who applies for the marketplace for this health coverage is going to be able to get some form of assistance to pay for the premiums. Now, health insurance benefits, premiums, depending upon your age, your family size, easily can be $8,000, $10,000, $12,000 per year. So the way the marketplace is going to work, people who are eligible for the benefits, and as I say, that's going to be the majority of folks, are going to get some kind of help paying for that premium. So just to give you an example, I'll just make an example up, but it's a real life example. If you have a family, 2 people in the family, their health program is going to cost $8,000 a year. Because of the amount of their income, they can get this assistance. They get this tax credit that's worth $5,000 in this case. That means that out of an $8,000 premium, this family's going to have to pay $3,000, spread out over 12 months. Yes, it's still a cost in the pocketbook, but it's coming into reach for more people because of these premiums. So this is one of the very most important pieces of the Affordable Care Act, the fact that people are going to be able to get assistance. The numbers that I have up there, 100% and 400% of the federal poverty level, that's how the program is put together. People between that range, that income range, and for a single person, that goes from like, or for a family of 4, 100% is about $22,000 a year. Family of 4 at 400% of the poverty level, it's like $92,000. So a lot of people are going to be able to benefit in one way or another. Now, the higher your income is, the less the rebate is going to be that's available for the premium assistance, as it should be. It's all based on family income and family size, and these credits are paid directly to the insurance company, just the way it was set up. When somebody registers, does an application, they go into the system, they determine what the level of their benefit's going to be. That's paid then directly to the insurer, so that the insurer is only billing you for the part that is your responsibility. Cost sharing reductions. There is additional assistance available for folks who have lesser amounts of income to even help pay for some of the co-payments that have to be made. Every time you go to a doctor, you have to pay a co-payment. Folks who have fairly low income are going to be able to get assistance in even making those co-payments.
I have a question.
Yes, please.
So now, as it stands before this, if you put out money, say you actually pay all of your health insurance for the month, or you pay all of your co-pays, whatever, you can write them off at the end of the year. Mm-hmm. Would you be able to still write off what you paid, what we pay in?
So,
because they're subsidizing it, I mean, how does that work?
My understanding, and I'm going to refer you to IRS or to your tax preparer for the full answer, but my understanding is that you can't, it'll be one or the other. If you go into the marketplace, your costs are going to be reduced, but I'm not 100% sure. So if you look at irs.gov/ACA, or if you call the number that I'm going to give you in a couple minutes, starting on Tuesday, they'll be able to tell you exactly how that is going to work. That is a very good question, and I need to have a better answer, and I will work on that. Thank you. Anybody else at this point? So, as I say, one of the things that we have not known here in Pennsylvania is just what is the cost going to be. And there's a website, the Kaiser Family Foundation website, that actually has a calculator that somebody could look at and get an idea as to what exactly it's going to cost for the family to get in there. So if we just look at this real quickly and we put in Pennsylvania, this is the Kaiser Family Foundation. It's a foundation that was started by the Kaiser family that owns Kaiser Permanente and the Kaiser shipyards. So what this tells us is that a family of 3, I'm just pulling numbers out, $23,000 a year, which is not much at all. This is what it's going to look like for them. They are going to pay $460 a year on a premium that they will receive $5,600 on. So that's just to give you an idea, and that's at kff.org. That's one of the ways that the system was put together. It's based, as I say, on income, family size, and you can easily determine what the family benefit is going to be. Let's talk a little bit about what the insurance is. This is a full package of health benefits. This is not, there are a lot of plans that are available today that some of us have or may have had that are more like bare bones or catastrophic, where you pay and if something happens, you have the responsibility to continue to pay, it seems like. So this program comes with all the benefits that any employer-based benefit insurance would have. It covers doctor's visits, it covers hospitalizations, it covers maternity and newborn care, it covers mental health and substance abuse, it covers prescription drugs, rehabilitative and habilitative services, laboratory services, preventive and wellness services, which is a very important one, and pediatric services. And in children, in the case of a child, it covers oral and it covers vision care. For adults, those two are not a part of the package, but there is a way to purchase those in addition, I understand. And we'll find out for sure on Tuesday. So what I'm trying to say here is that these are the things that people most want in a healthcare plan. The ability to go see your doctor when you need to, the ability to get preventive screenings, trying to do some proactive self-care, make sure that we're healthy, whatever. All these things are covered. And some of the things that we don't think about sometimes, like laboratory costs and rehabilitative services, those things are covered too, if you ever need them. Hopefully we don't, but if you do, they are there. This is what the enrollment period looks like. On Tuesday, October 1st is a day that many of us have been working hard and furious towards. That's when this marketplace opens. The marketplace will stay open until March 31st, 2014. So it's a 6-month period for people to learn a little bit about it, take a step in the water, hopefully apply, and if you're eligible, that you're able to participate in the program. These are the key dates. This is how it's going to work. And I've been spending a little bit of time making sure that people get this part, because a lot of folks, when they hear October 1st, it seems that like, okay, so like November 1st I'll be covered. The enrollment period is for 3 months. It's actually for 6 months, but for the first 3 months, it's just enrollment into the program. The coverage for everybody who enrolls during October and November up to December 15th, their coverage will begin on January 1st. People who enroll on, say, January 17th, it'll be the next month plus, just the way any other program is of insurance. The last day to enroll for this program, absolute last day for this first open enrollment period, is March 31st. Somebody who enrolls on March 31st, they'll be eligible for their benefit on May 1st. But the important thing here is we got 6 months for people to get the information, think about it, and take action. When we get to March 31st, it closes. It'll open again next year. October 2014 will be our second open enrollment period. At that time, it'll be more like the Medicare open enrollment period. It'll last for 3 months as opposed to 6. So these are critical things to think about. The clock will start ticking on Tuesday, and there's about a 6-month period to get the coverage. This is a little bit about the enrollment process. The enrollment can be done online, and we're going to look at their website for a minute. It can be done over the phone. It can be done by mail. They've got a simple form that can be sent to you. You can complete it, send it back, and it can be done in person. There are 2 groups of people who will be in each of the states that are called enrollment assisters, and they're called navigators, and they're called certified application counselors. But the important thing is that they can help you face-to-face make an application for the Affordable Care Act. There's no fee involved in that. They will be based throughout the community, and I'll give you an idea who they are in a couple more slides. The marketplace verifies and determines everybody's eligibility. One of the nice things about this program is if you've ever had any other form of public benefit, I've used public benefits in the past. The way it used to work was you had to get your shoebox out and gather all kinds of pieces of paper, go down to the welfare office. I needed my rent statement, I needed my utility, I needed my last paycheck, I needed my Social Security card, not the number. These are barriers that sometimes complicate people getting benefits. So one of the great things that they've done with this is you don't need to produce these things. You need to have them when you make your application, but you don't have to throw everything into a box or a bag and go across town to see somebody. So if you do the application at home on the website that we'll take a peek at in a minute, you just have to have Social Security numbers for everybody in the house. You have to know what your income was last year, and this is verified through IRS, and whatever, and just basic information about your family members, ages, etc. It's fairly much to the point. My understanding is that the paper application is going to take as little as 15, 20 minutes is what I've been hearing. So it's a couple pages long, and it's very much to the point. What the marketplace will also do when somebody goes in and starts making this application is they'll look to see who's in the family and who's eligible for what. And there will be some families that have more than one insurance option that they need to use. Family at the lower end of the income level, they may find that their children fall into the Medicaid program or to the CHIP program. The marketplace will ensure that one application puts you in the right place. So again, it's not running around from program to program trying to figure out where can I put my son, where does my wife go. It's all done through one application. Enrollment assistance. These are the people who will be able to help everybody make an application. Now, as I said, there's 4 primary ways to do it. You can do it online, you can do it on the phone, you can do it by mail, and you can do it face-to-face with one of the enrollment assisters. What's interesting to me is this website, they've got the ability to handle 150 of the most common languages. They've got some kind of a magic phone, and that's all I can say to explain it, because I don't understand the technology. But I talk to you through the phone, and it translates into the language that you're talking into it, and then it puts it back into English so that I know what you're saying. The magic phone. There's chat on the website. Anybody who's comfortable going in and wants to use chat, you can ask questions. They can assist you as you're going through. It's a very cool thing. Help in person, the navigators, as I say. Now, the navigators have to go through 20 hours of class in order to be certified. They are all certified, and they, at no cost to any consumer, you can make an appointment, and they will sit down with you and make your application. We also have, as I said, the certified application counselors. Certified application counselors are certified. They have to go through 10 hours of class. They have to take tests. Both groups take tests, and you have to score at the proficient level or you're not certified to help somebody. Interesting thing about who can be a navigator, it's put together so that the insurance companies are not permitted to be navigators. So we're going to hear a lot from IBX or Independence Blue and whoever else is in our market. We can take care of you. No, they can't. You have to work either through the website, through the phone number, or you have to make an application with a navigator. And the reason is they don't want to steer anybody in one particular place. See, in Pennsylvania, here in Philadelphia, we're going to have something like 8 plans, I believe. And each plan is required to have 4 levels. The levels are bronze. You don't need to remember any of this. You'll see it when you're making an application. Bronze, silver, gold, and platinum. And they equate to what it's going to cost you in terms of your premium and in terms of what your co-payments are going to look like. And then they match the tax credit to each one of these levels. What they're really, I I think that the ideal is that people are going to be looking at, say, a silver plan, whatever that means, and that's where your tax credit comes in. You'll know what you're going to have to pay, and you'll be able to get your insurance card and see people in that plan. So as I was saying, it looks like there's going to be 8 providers here serving our area, and times 4, so there's going to be 32 choices. So this is one of the reasons why they've got the navigators, and the navigators are going to be based across the city. They are based out of, not far from here, there's an organization called Resources for Human Development. They got a navigator grant. I have their information, I'll give you in a minute. But what they will be doing on their website is setting up a schedule as to where navigators will be able to be found in the community. Or you can make an appointment to come into their offices and they'll be able to sit down and assist you. The federally qualifying health centers, or the community health centers as we refer to them, most of these, if not all, will have certified application counselors. So if you know of a clinic, that's another place. Hospitals are probably eventually all going to set up to be able to help people make applications. Because another thing that this program is going to do, as people start to get the coverage, it's going to make compensated care shrink. So that $3 trillion that we were looking at a couple minutes ago is going to start to come down when people aren't using emergency rooms quite the way that they're used today. Yes?
The Resources for Human Development you're talking about, is that staffed yet? I saw job opportunities posted for that.
Well, they're working on staffing up. Yeah, they're working on staffing up. I mean, here's the reality for how all this came down. The Navigator grants were awarded on August 15th. So nobody knew who was going to be a Navigator until then. And then when that was released, these organizations went to work immediately and started building an infrastructure, hiring staff. They have been advertising. They may still have openings, I'm not sure. I know they have some of their staff on. Here in Philadelphia, we will also, I'm sorry? I don't know. I'll put up their website in a minute and you can figure out how to get that kind of information from them. I'm not sure where they are in their hiring.
Yeah, just as of 2 days ago, I still saw the postings out there, so.
Yeah. Yeah, I mean, if that's something you're interested in, I would encourage you to contact them. Yeah. Yes, sir.
So the 8 providers in Philadelphia, will all of their silver plans or bronze plans all offer the exact same provisions?
Yes, sir. That's one of the things about this marketplace. Every plan on every level by every provider must cover that group of services that we talked about. Okay. Every one of them. They can't just say, yeah, we're going to give you doctor coverage, but not hospitalization. It's a package. Good question. Yeah. Anybody else?
I have a question.
Yes.
Yeah, I read in the New York Times the other day that there was going to be a networking, that if you signed up, you can put in a network of doctors and hospitals that you go to, and you it's kind of like an HMO experience. Do you know anything about that?
Yeah, again, unfortunately, because our state hasn't been involved, we're not going to know exactly what these things look like until Tuesday.
Okay.
I wish I could tell you. I think it's safe to assume that some of these bronze levels are going to be more like an HMO,
Okay.
and some of these platinum levels are going to be more like a preferred provider organization, a PPO. But they all must make provisions in terms of the benefits that people are able to take advantage of.
Now, one more question.
Yeah.
Some musicians aren't necessarily current on their, tax forms. Now, if that's, hey, we've opened that. Does that preclude them from signing up if they didn't fill out a tax form the last 2 or 3 years?
Or 10 or whatever? No.
They could still just put in what they made.
You can. There is a way that a self-declaration of family or individual income can be made. Anybody can do that. I mean, first thing, one of the things that their systems do, they do talk to the IRS computer. So when they start putting in the Social Security number, if nothing comes back, that's their first clue that a document had not been filed. And you know, in our country, below certain levels, you don't have to file, and if it's part-time and whatever. So no, that's not an issue. But once you make this self-declaration, which lasts for a year, you're going to have to start filing taxes thereafter.
Doctors can help you with that, if anybody's here like that. Okay, thanks.
But that's,
so it sounds like from what you're saying that the coverage that's going to be in effect in 2014 is going to be based, the subsidy for that would be based on my 2012 tax filing. Is that right?
that's correct. That's correct. And if things have changed, if your circumstances have changed, again, you can make a self-declaration that they will accept. Because it does change. And things change during the year. Could be in addition to the family or in the other direction, change in job, change in level of income. And you are able to go back in and talk to the marketplace and make an adjustment. So if you locked in and your premiums are $600 a month, say, because of your income level, and then your income level drops, they can make an adjustment for that. So it's a pretty smart program the way it's put together for a government program.
If somebody is working as an employee for a company and they're not getting a very good health plan and they have to pay out most of it, let's say, can they apply for the to get their own health insurance through the exchanges, or are they kind of stuck with the plan that their employer offers?
That's another very good question. I'm taking these questions with me. I'm going to work them into this presentation.
Bill, I think the article in the Inquirer today, I believe somewhere in it, I read the whole thing, but I couldn't tell you where, addresses that. And I think the answer is yes, you can, but I think it depends on the income level.
Yeah, there are some caveats. Okay, first off, if you work for an employer who provides health insurance, you still want to look. The rule is if you get it from work, you're not going to get it here. But there's some caveats in there, and the first one is depending upon how much of your personal income you have to put into it. And I want to say that the rule is about 8%. If you're spending more than that, then you would be eligible to go in. If your benefits at work aren't providing the level of service that the marketplace is, there may be a caveat for that. So anybody who's not sure, I'd check out this website or talk to a navigator, because they can tell you for certain. Or this phone number. This phone number is to HHS, 1-800-318-2596. They answer it in 150 different languages. They can answer a very specific question like that. But anything that's not cut and dry or for sure, certainly worth looking into. Yeah. Yes, sir.
I've been in and out, so pardon me if I'm missing. Could you cover pre-existing conditions?
Pre-existing conditions, only to say that they end on January 1st. In terms of it cannot be held against somebody purchasing health insurance. Yeah, that's one of the landmark pieces of this legislation. Yeah. I think you, and then you, okay?
Me?
Yes.
Thank you. So the income level is really for the subsidies and the tax credits, right?
Mm-hmm.
Now, in my situation, I have a business where I have a high gross and a low net income. And it's been my experience that when I want health, they go by my gross, and when I want to show income, they go by my net. Do you have any sense of how this is going to play out here?
They are going to, I don't. I'd be happy to talk to you afterwards, and we could try to get an idea if that high gross, where that's going to put you in this.
All right.
Yeah, if you like, yeah. And let's see, you and then you. Yeah.
I have two questions. Pre-existing conditions, I understand that you can't be denied coverage if you have a pre-existing condition now, but will your premiums be higher if you have a pre-existing condition? So you won't be penalized in any way?
You will not be penalized in any way. I mean, right now in Pennsylvania, there's a special insurance people with pre-existing conditions can pay for, and it costs a lot more. And with the end of using a pre-existing condition as a condition of insurance, that all goes away.
And you do the providers that you have available to you change depending on where you live in the state?
Yes. Pittsburgh, for instance, will have 5 providers. I believe the state of Maryland has 1, so it's varying widely across the state and across the country. Here in our region, and again, that'll be defined, we'll know the definition of that on October 1st. I'm assuming it's the 5 counties here in the Southeast. They will have 8 providers to select from. Yeah, and for sure I can tell you 2 of them are Blue Cross, Independence Blue Cross, and there's another insurer from Pittsburgh called UPMC Health Plan. They are both coming into the market, but I can't say for certain anybody else because they're just simply not, there's been a lot of speculation, things have slipped out, but officially stated, those are the only 2 that I know of. And then there was a question.
So actually a statement. I don't know, if you have the insurance already, if you can prove that you have within 60 days, 63 days, there are some plans, like I got a supplementary plan to kind of cover me until this started, or depending on what the price is going to be. If you can prove that you've been insured within 60 days, 63 days, they cannot deny you for your pre-existing condition. So if you have something that's terrible, like an insurance that's terrible, and you want to switch over to this, you still have insurance. So that's it. And then January 1st, everybody has to be covered.
That's right. That's right. Yes, sir.
Will the cost of premiums depend at all on age, or will a 23-year-old pay the same as a 63-year-old?
No, they are going to go by age. They are certainly going to go by age. A 22-year-old in Philadelphia, it was in the newspaper, I think that they can get a plan for as little as 119, I think was the number that I saw.
Per what? Year or month?
Per month.
Oh.
That's monthly. That's
I came in after you talked about that.
somebody who's closer to my age. It's going to be, I think it was, I want to say $300 a month at age 40. 42, I think, was the example that they had. Do I have that example up here? No. But it is based on age too. Age, income, family size. Yes, sir.
Can I go across state lines to get a different deal?
No. You have to buy from the marketplace of the state you live in. Just like it's not like wine. You can't get a Jersey and get a cheaper wine or a better selection. That's a good question. It's a very fair question, but they've set them up as a state-based marketplace. And the costs are going to vary tremendously. What they're paying in the western end of the state is going to be much lower than what we pay on the eastern end of the state. And that's driven by the market forces and what they're currently selling insurance for.
When I first walked in this afternoon, up there it said $460. I was like, a year? That's why I asked that question after Dave asked what he said. Because it's not a year. I mean, right, that's $460. Maybe that's the number you're looking for an adult, $460 a month? Is that possible?
I think you came in when I had it for, I had the family example up there that had $23,000 income, and their annual is going to be $460.
Because it's the percentage of the poverty level.
$460 a year.
We'll go back, I'll pull that website up again.
Thank you.
But yes, it depends on family size, level of income, et cetera, and credits that are available.
How about my husband who's on Medicare? I told your age. I mean,
Well, were there anybody here on Medicare that the only way that Medicare changes, you don't go into the marketplace. The only changes to Medicare are the donut hole in prescription drugs is going to go away. And they had to add this year preventive screenings and preventive services. That's the only change to Medicare. So when somebody gets to that point in its Medicare, you will deal with Medicare. And I think their open enrollment period starts on October 15th and goes through December. So there's going to be a lot of activity out there. Yes, sir.
On the geographic line of question, if you purchase your insurance here and you live here, but your work takes you out of state and you happen to need medical care while you're traveling, is that all covered or?
Yeah, I mean, I have whatever I have through my wife now, and I travel a little bit with work, or even take a trip, go see family or something. And these companies have provisions for those types of things. It's going to look a lot like the typical plan that's out there, in that there'll be reciprocal agreements. Yes is the answer. If you're away, like if you're still a permanent resident of Pennsylvania and you're carrying your marketplace card from Pennsylvania, yes, there will be a way that the provider and the caregiver will be able to work that out. Yeah, good question. Yes?
I'm not sure, I just want to ask you to clarify something. Did you say that if you have a pre-existing condition, but you didn't enroll before January 1st, you won't be able to get, it doesn't apply?
No, on January 1st, the pre-existing condition clause goes away. That will not be asked ever again in the marketplace as it's put together. Because that has, for many good reasons, that goes away. On January 1st, pre-existing condition clause goes away. Yes, sir.
When you say it goes away, does that mean that there's no more physical exams or blood work? Or, I mean, when I applied privately a few years ago, somebody came to the house, they took my blood, they took blood pressure, everything, besides, you know, me having to fill out everything. Will there be will there be nothing like that anymore, or will there be any kind of screening for any kind of conditions?
There will not. I mean, you're talking about a specific kind of health insurance that does a lot of screenings up front and probably has high co-payments and things like that.
Well, it was just it was a HMO from Blue Cross.
Okay.
They said you have to be underwritten.
Okay. Okay.
Which means they can't give me automatic coverage. So,
yeah.
You know, me and a bunch of people failed.
Yeah.
To qualify. I won't go into why. Nothing major. So it was very surprising that they didn't accept me and other people that were seemingly healthy.
Yeah.
Because it's major medical, and that's what they're doing now. Sorry.
Yeah.
The major medical is trying to keep people out, so they're not going to be able to keep people out after January. So all of this that you had before, you're not going to have that now.
It's all going to change. I mean, on the questions, they ask you if you're a smoker. And that's like the one prominent screening question that they have in there, in addition to your demographic information, family, income, et cetera. And if you're a smoker, they're allowed to charge 50% more. But they're not. I mean, what the rumors I'm hearing about rates is they're not going to be 50% more, but they're permitted to do something like that. Let's take a look at this this website here for a second. Healthcare.gov. This is run by the Department of Health and Human Services. Again, since Pennsylvania does not have its own marketplace, people from PA can go into this website, and this is one of the better websites that I think I've ever seen, particularly for a government website. It's not real text heavy. It's put together in fairly straightforward language, and it's easy to navigate. Now I say that, but still the curtain's down. I can only go so far into it, but I just wanted you to see what was here. And it's also available in Spanish. And for the web, it's only going to be English and Spanish, but as I say, they've got the magic phones that do 150 languages, so they can accommodate almost anybody. So if you just click on here, and you can do this now, you just can't start the process. You can go in and you'll be able to see it starts interviewing you. A few questions to get you going here. What best describes you? Okay, well, I'm looking for my family. And I'm a male, and I live in Pennsylvania. And I'm 30 to 60. And I'm going to say I don't have health coverage. I'm not eligible for insurance through my employer. And
for musicians, it would be self-employed, most likely.
And it'll only take you this far, and it says come back on October 1st. But what the point of my wanting to show you this is just to show you that this is going to be fairly straightforward. That's the actual process right there, but this gate will be lifted on October 1st, and you'll be able to continue with the information, where do I live, my address, who lives with me, Social Security numbers for everybody, income for the last year taxes were paid on, or the last tax year, and it will proceed from there. The next page that you would go to after entering that information, who the 8 plans are and what the different levels look like. That's one of the reasons why I think it's really beneficial that we have these navigators and other enrollment assisters available. Some of us are going to be fine to sit down with the computer and just click right through, see these plans, see what we want, and go on. And that's great. They figure millions of people are going to enroll in it this way. But for lots of the rest of us, there are going to be other ways to enroll in this program. So, if anybody, pardon me, if anybody has a business, runs a small business, you can also take that link off of the front page, which is called just small business. And they have something in there, it's called the shop. You can go in there and it'll give you a lot of information about how that works, how you can make decisions about your business, the people who work for you. But I'm only talking about consumers here today and individuals. We really have not focused on that at Enroll America. So anyhow, I encourage everybody who's got access to a computer to take a look at this sometime after the 1st, healthcare.gov. You know, there's a lot of people waiting to check it out. On the 1st, it may be a little slow or it might be down. But if it is, I'd say come back on the 2nd or the 5th or the 17th, take a look at it and see what kind of information is in there. See if it's able to answer the questions that you have, and see if you find yourself looking at options that are going to make sense for you.
Since the,
2 in the morning, yes.
oh, I'm sorry.
No, go ahead.
Since the corporate administration hasn't allowed these exchanges to be set up by different providers, so it's the federal government that's going to put the providers in there for people, right? Mm-hmm. And do you know who they are yet, who's been chosen, or? Yeah,
as I say, we won't know all of that information until the 1st. I know, I have been told that Highmark, Independence Blue Cross, and UPMC Health Plan will be 3 of the choices. Pardon me, I don't know if all 3 of those will be in our market. Independence is going to be one of the providers. And then in terms of, you know, a question that's come up a lot is, well, can I still see my doctor? And some of the opposition has been saying you won't be able to see your doctors. You're going to have to see whoever the government wants you to see. And no, that's just not the case. As a matter of fact, the insurance companies would not be spending their time and resources if this was going to be nothing but a lot more work of having to go out and reassess every provider and put them into the system. The understanding that I have heard is that if you go to Independence Blue Cross and you're looking at a plan similar to something you have or that you've had, it's going to look very familiar, the providers who are in there. I expect that over time, over time, they're all going to be in there. I don't think there's any going back from this. Yes, sir?
The navigators and those folks in the community who are going to be out there as helping hands, support folks. Yep. Who will be responsible for the communication to the broader community about where those folks are? So in other words, how would I know? Will I be reading it through the newspaper? Will I be getting it from Philly.gov? Where will I be getting it?
Those are 2 good places where hopefully you will see it. Yes, seriously. I've been meeting with the city, and I believe that they are going to publicize which of their health centers and other places have this kind of capacity. The media, yes, we've been talking to the media and asking them to help publicize this. We're trying to establish a calendar that would be shared among all the providers that we could make publicly available. I don't have that yet. I can't tell you where to go for that. You can also go, and you can also go, I'm sorry, I had this website up here in front of me a minute ago. Healthcare.gov, behind where we can't get today, when you put in your zip code, it'll tell you everybody who's doing it. Yeah, I should have thrown that out sooner. So you'll be able to go there, Philly.gov, hopefully lots of places, the evening news, the morning paper. It's a very good question. If people don't know where to go, they're not going to go. Yes, sir?
Okay. If you currently qualify for independence special care. You familiar with that?
No.
It's Blue Cross.
That's set up like on your, again, it's an income. And,
Okay.
I know we pay like $155 a month or something like that. It's limited, but it's there. Do you know if those programs will still be in existence when this comes about?
I don't think anything's going away, but I think that by looking at healthcare.gov, you may find a better plan at the same or less money.
Okay. I think I can answer. I received a letter yesterday explaining that that is canceled as of January 1st.
Okay.
What's up?
Special care.
Yeah, it's
That
what?
special care program will be canceled
Will
as
be-
of January 1st.
It will be canceled?
Yes.
Okay.
And that's because of the marketplaces coming in, I assume.
And they said that it's an IBX program.
Yep.
And that they will be sending information concerning other avenues, which are the ones that you're discussing now. But that plan will be canceled.
Okay. That's. Yes, sir.
So for those of us who have individual, or in my case, through company insurance, it still would be a good idea for us to right away, or as soon as possible, to compare. You said that, I think, right?
Oh, yeah, it costs nothing to take a look and see what's there. Absolutely.
And the second thing is, are those companies who already have you going to somehow push back and make it difficult for you to switch? Or maybe there is no way they can do that.
No, I mean, they can't do that. You're now making an application through the Department of Health and Human Service, well, with an insurance company that's facilitated by the Health and Human Services. So they may hate to see you go, but they cannot entangle it in any way. Now you may have, depending upon the length of your contract, that may come into play, but they can't stop or make it difficult to change.
How many contracts have a length, and how many can you cut?
Well, this marketplace is a one-year healthcare contract. So when you sign on and it starts January 1, it'll run through December 31st. January 1, December 31st. And open enrollment comes around again next year. You'll look at options. If you didn't like what you had this year, you can make changes to it. Yeah. Yes, sir.
You're not tied in any way to stay with it for a year, are you? I mean,
Yes.
What if in half a year you're eligible for Medicare?
Oh, well, I mean, there are major life happenings or occurrences that kind of overplay these rules. If you hit the age and you're eligible and you enroll in Medicare, yes, you can get out of the marketplace. Yeah. Yeah. Yes?
What if you get a job after you sign up? You can keep it.
You can keep it through that period, through the 1 year that you have enrolled for. You're not going to get something cheaper from an employer. Now, if your eligibility changes because they're offering an approved health plan, then you may have to opt out of that and go into the employer. But again, this is something that these navigators and this healthcare.gov can give you ironclad answers to. But that's my understanding is how that's going to work. Yes?
If you're signed up for one of the plans and are on the year contracts, can you downgrade or upgrade your plan like within that year?
I don't think you can. I think it's kind of like Medicare. With Medicare, you pick your plan and then you have it for the 12 months. Yeah. Good question, but it's just kind of the way the markets are. They just lock people in for a 1 year period to avoid people moving from plan to plan.
Unless there's something like marriage or...
If there's a major life experience, a marriage, pregnancy, change of job, change of income, any of those things then might allow you to opt in to the program or whatever. Yeah.
You've got about 5 more minutes, so are you almost through?
I got one more slide I want to put up here. These are the in-person assisters that will be serving our area here. This is RHD, and that's Resources for Human Development. They have a contract to cover these counties, and that's their toll-free number, that 855-668-9536. That's their email address if you want to shoot them an email, healthinsurance@rhd.org. They are staffing up right now. They've been training people. They tell me that on Tuesday they will be ready to go. I just talked to them yesterday. Congresso in Eastern North Philadelphia will have certified application counselors. That is their phone number right there and their email address. There are other health clinics. These are the only two that I could get a hold of for this presentation today. Most health clinics, community health centers, will be able to help you make an application. And eventually, I believe most of the hospitals will have that capacity as well. The other navigators serving our area, the Mental Health Association of Southeastern Pennsylvania, they're simply not ready to go yet. That's why I didn't put their contact information up. Everybody got this news on August 15th. RHD was hedging their bets. They were ready to roll. Some of the others were not ready to go. Some of the other navigators are not going to service our area. So I just want to give you two examples of people here in our community who you can reach out to with questions. You can meet with them face to face, whatever you like. Any other questions?
This is assuming that this passed, that the government gets off their ass for months or whatever. Because that's not the why of it right now. Because I heard that the Congress has passed with the 1 year abatement, whatever, not having this coming effective for a year.
Not the Senate.
No, just the House of Representatives.
Yes.
The Senate didn't pass that. It takes both houses, and then the president would have to sign it.
Yeah, well, I'm saying that the one house, what they just
Yep.
passed,
Yep.
just said that they will not, they're going to put it off for a year.
But they're not. It's not going to happen. This will open on Tuesday, October 1st. This program was pre-funded. All the money's in place to make this happen.
Okay.
And no matter what happens in Washington in the coming days or weeks or months, however long this might take, none of this is going to be impacted.
Okay.
The rules are the rules. This was passed 3 years ago, upheld by the...
That's not what the way they make it sound.
I know. That's part of why it's important for me to get out here and try to talk to you. This is the law of the land, upheld by the Supreme Court. It rolls out on the 1st. They can carry on, and you're going to see stuff depending upon what station you're watching or what you're reading. There is some opposition out there. I came here just to bring you the facts as they come from the Affordable Health Care Law.
Right. All right, let's hear it from Bill Anglin.
Thank you.